So welcome everybody. I'm Sherilyn Stevens. I'm your host for the a Bahá'í-inspired series titled Racial Healing, Racial Justice. And this series was started and is sponsored by the Baha'is of Wacomico County and Salisbury, Maryland. And we're very fortunate this evening. Actually, one of the other Baha'is here in Wacomico County is actually our presenter tonight. That's Malinda Cecil. But you'll hear more about Malinda in a moment. First, as always, we start out with a devotional portion. And during this time, you're invited to think of, call out, put in the chat, any ancestors, both of blood or spirit, individuals that have passed on that you feel close to or connected with in some way. And this is an opportunity to remember them. When in the state of prayer, when we're praying for them, they can also pray for us, and they can assist us, and we can assist them in their progress in the next world. So we invite you to take that time to do that. We'll have some drumming, which is at the rhythm of the human heartbeat that we'll hear, and that's a wonderful time to do that. Gina is singing a prayer for us. It's pre-recorded, so she's not actually singing, but it is her voice. That's Regina Yunker from Kelowna, Canada. And then we will have Chuck Hendrickson will be doing a prayer for us, also sung. And of course, we'll have a reading of a prayer or two from the writings. And we will also have a YouTube video titled Joy Gives Us Wings. And then after that, we'll conclude the formal devotional portion, and we'll come back together. I'll introduce our speaker, and we will get to see her wonderful presentation and have Q&A afterwards. O my kind Lord, O thou the desire of my heart and soul, bestow upon thy friends thy loving kindness, and grant them thine unfailing mercy. Be thou a solace to thy ardent lovers, and a friend, a comforter, and a loving companion to them who yearn for thee. Their hearts are ablaze with the fire of thy love, and their souls are consumed with the flame of devotion to thee. They long, one and all, to hasten unto the altar of love, that they may willingly lay down their lives. O divine providence, grant them thy favor, guide them aright, graciously aid them to achieve spiritual victory, and confirm upon them heavenly bestowals. O Lord, assist them with thy munificence and grace, and make their radiant faces lamps of guidance in assemblies devoted to the knowledge of thee, and signs of heavenly bounty in gatherings where thy verses are expounded. Thou art verily the merciful, the all-bountiful, the one whose help is implored by all men. Abdul Baha. Mm-hmm. 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 Oh God, my beloved. Oh God, my heart's desire. Mm-hmm. 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 Oh God, my
my beloved, O God, my God, my heart's desire. Mhm. 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 Oh God, my God, my beloved, oh God, my God, my heart's desire. Mhm. 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 Oh God, my God, my beloved, oh God, my God, my heart's desire. Mhm. 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 Mhm.
My God, whom I worship and adore, we the children of the earth are poor and needy. We sorely need thy wealth of love. Let thy compassion reign on us, we do beseech thee. Thou art the mighty and the powerful. Thou art the strength of love and mercy to the weak. Thou art the table of bounty set for all. O God, unite the hearts of men while yet we speak. O God, who made humanity from a single mold of clay, and let us grow to fill this planet Earth. We pray thee, let humanity be one again today, and return us to the oneness of our birth. Thou art the mighty and the powerful. Thou art the strength of love and mercy to the weak. Thou art the table of bounty set for all. O God, unite the hearts of men while yet we speak. O God, raise aloft the banner of the oneness of mankind, and cause the hate and loneliness to cease. O God, melt our hearts together and illuminate our minds, and establish for this world the most great peace. Thou art the mighty and the powerful. Thou art the strength of love and mercy to the weak. Thou art the table of bounty set for all. O God, unite the hearts of men while yet we speak. O God, unite the hearts of men while yet we speak.
Joy gives us wings. In times of joy, our strength is more vital. Our intellect keener, and our understanding
All right, that was wonderful. Thank you. Yeah, that was just delightful. So thank you in reverse order of sharing this afternoon, this evening. Um, the Joy Gives Us Wings children. I don't know if that's their name, but they were just so cute. And Chuck Hendrickson for his wonderful song that really epitomizes so many of the principles of the Baha'i faith. And Regina Yunker for her song. And myself for reading at the last minute. I was supposed to invite someone and I'm sorry I didn't. I said, oh, I guess I have to do it. So my apologies for that, but we'll do that next time. So thank you. So with that, let's get on with our presentation here this evening. I'm delighted to welcome Malinda Cecil. Malinda is a Baha'i here in Wicomico County, Maryland. She and her husband Bill have been here for quite a long time. And they have always been avid exemplars and persecutors, you know, against racial injustice. And in fact, Melinda's been a Baha'i for over 40 years. And in fact, in the 1990s, when they were a relatively young couple, they had decided they were going to move somewhere in the South. And originally they thought they would go to Georgia. And Malinda tells me they had a conversation with Sue Fouts, who some of you may recall. And Sue Fouts had a conversation with Bill Sears, William Sears, who was a hand of the cause. And he says, no, I think they should go to Selma. So they ended up going to Selma, Alabama. And while they were there, they helped establish the first local spiritual assembly of the Baha'is of Selma. So Malinda has a long history with the faith and a rich one of active service. Tonight, we're delighted to have her here with us to give us a presentation about an area of study and research and action that she is intimately familiar with as a doctorate, and also her work as a dietitian and as a professor at Princess Anne, which is a HBCU here in Princess Anne County, Maryland. So with that, I'd like to welcome Malinda, and we're all ready for you. Thank you so much for being here. And friends, she is one of the other, well, there's 4 of us total, but she's one of the 4 who said, no, when we do these devotions, let's do it on racial justice. So here we are. Malinda, it's all yours. Thank you for coming.
Thank you so much, Sherilyn. I want to first say that I come here with an attitude, as always, of humble learning. I'm obviously white, so when I get into my discussion tonight, you know, in full transparency, I have not personally experienced some of the things I will talk about, but I'm intimately aware of it, having worked in public health for over 40 years, having worked in public health in Selma, Alabama, one of the poorest counties in the United States, and also having worked in Montgomery County, one of the richest. And so I do hope that brings me, you know, a unique perspective, and also having worked in as a minority in really the last 19 years of my employment and work in the profession of dietetics. But I want to thank Sherilyn, because even though our community got together and said we need to do something after reading the letters from the House and our National Spiritual Assembly this summer, we just knew we needed to do something. And it was Sherilyn that, you know, initiated this and made it all possible. She's the one that's put the energy and creativity into these presentations. And we are so grateful for all of her work in our community. And she's really kind of put Wicomico County on the map now. And we appreciate that so much. So I'm not sure how many of you realize that, yes, it was our community's decision, but if it hadn't been for Sherilyn, this would have not become a reality. And I'm very grateful for what she's done. Thank you. All right, well, let me now start to present and start with my presentation. I've selected the topic tonight, Exposing Racial Bias in Minority Healthcare, Implications for an Ever-Advancing Civilization. What this means is that when we think about the fact that the all-knowing physician hath his finger on the pulse of mankind, he perceiveth the disease and prescribeth in his unerring wisdom the remedy. Baha'u'llah, prophet founder of the Baha'i faith, describes the prophets of God as physicians whose task is to foster the well-being of the world and its peoples, that through the spirit of oneness, they may heal the sickness of a divided humanity. As most of you realize, I'm sure, health is much more than the absence of disease. It is the ability to reach the highest levels of both material and spiritual existence that will allow for an ever-advancing civilization. So what does it mean to experience an ever-advancing civilization? And to quote from Pope Francis, one where injustice is not invincible. As mankind progresses from adolescence to maturity, it will become imbued with new virtues and powers, new moral standards, new capacities, free from all forms of prejudice and racial bias that hinder material and spiritual progress. There will evolve world-encompassing unity and allow all to soar on the wings of joy. Racial bias in healthcare keeps us all from soaring on wings of joy. And specifically in times of joy, our strength is more vital, our intellect more keener, but when sadness visits us, we become weak, our strength leaves us. Although ill health is one of the unavoidable conditions of man, truly is hard to bear. The bounty of good health is the greatest of gifts. And since we become and have the joy that gives us wings. So wishing thou health for serving the kingdom. So health is so important to our ability to reach our full potential. However, healthcare in the United States is viewed more as a privilege than a human right. And this has been a contradiction or a battle or a point of debate for the last, I would say, 70, 80, maybe even 100 years. Do we as Americans consider healthcare a privilege or a human right? And from this stems, I think, all the problems in terms of the disparity. And even for many, even affordable healthcare is out of reach. And in public health, this is characterized often by issues of health disparity and health equity. It is indeed an issue of racial justice. So what are we talking about when we talk about health disparity and health equity? And they are different. Equity is the justice. And so I want to share with you, and I'm not going to read all of it, but you can see how the United States Public Health Service basically defines health disparity. It is a particular kind of health difference. It can be closely linked to economic, social, environmental disadvantages, but it affects groups of people who have systematically experienced greater social or economic obstacles to health based on their racial or ethnic group, or their religious background, their social status, gender, age, or mental health. But it is historically linked to discrimination or exclusion. And I think that is the key. And of course, as Baha'is, we're trying to eliminate all of these issues of racial prejudice and disparity. Principles of health equity imply action. It is a commitment to reduce and ultimately eliminate these disparities, striving for the highest standard of health for everyone. ethics, and human rights. So for American Blacks, though, there's a lot that have affected it. You have the legacy of Jim Crow, post-Civil War, where legally and intentionally there were discriminatory practices. You had early gynecological studies on Black women where they were subjected to surgeries without anesthesia. And of course, you have the Tuskegee syphilis study or experiment, which was the great betrayal of the American Black community, where men in Tuskegee who were many times illiterate, who presented with syphilis, were denied a cure, basically, and it could have been easily cured, to see what would happen to these men. This study did not end until 1972. And I think I was a junior in high school and this was still going on. It's a tragedy. And what it did, it broke their trust. And it resulted in broken trust with the health care community. So what does this look like today? What kinds of things? And certainly in the middle of a pandemic, if you've been reading any news or listening to anything, you know that it has come to our attention. This is an issue that I've been concerned about for many years, working in public health, but the pandemic has certainly amplified it for many more, I think, Americans. And I think it's now really gotten much more visibility, even though it's been with us for decades. So I'm going to show a series of charts that were put together by USA Today, which show how these racial disparities continue to persist. Poverty rate, no surprise. When we look at Black women and childbirth, they are more likely to die 3 times more often than white women. And we also know that when Black women have Black physicians, they have better outcomes for childbirth. Why is that? That shouldn't exist. Black Americans are dying at a disproportionate rate from COVID-19. And here in Maryland, there's been concern that Black people are not getting the vaccine. They're not either having access to it or they're very suspicious. And that gets back to the history of these horribly discriminatory practices which have existed for decades within our American health system. And it's no wonder. I don't know if any of you had the bounty of listening in February to a presentation that was organized by the Chair for Peace, the University of Maryland, in conjunction with the University of Maryland School of Public Health. And it was on this issue of health disparity and access to COVID-19 and the reluctance. And one of the professor that was speaking from the School of Public Health actually went back to Tuskegee. And he showed a video of, he accompanied the mayor of the town who went and got his vaccine. Because Tuskegee is that ground zero of where this tremendous break in trust occurred between our public health service and healthcare and our Black community. Race impacts longevity. And you can see this, and of course we realize now in this year of the pandemic, longevity is even for everyone taken a toll and has been decreased at least by a year. Black unemployment rates are usually among the highest. And also inmates in federal and state prisons. So what does all this mean? When we're looking at income, that people, because of whatever reason, their color of skin is making a difference in their access to these services. Now, there are myths about Black Americans, but what is important to understand, and when you read people who have studied this for a long time, they want to make very clear that race is confused with ethnicity. Race, as we all know, is a social construct. It has no basis in genetics, in biology. And we often say that these disparities in care are caused by social determinants. No, it is an issue of racial justice. And that's what's important for people to understand, that this systemic and sometimes unconscious or implicit bias exists and has made a difference in the access to care. Some of the myths that are perpetuated is that Black people have an inborn immunity disease, and this dates back to yellow fever and smallpox epidemics. There's a higher risk for diseases genetically determined. Well, no, in reality, it's more related to high-risk occupations, manual labor, and the stress of racism. Specifically, there are these wrong assumptions which are still held by many in the healthcare community. Black people present the same way as white people. That is not true. Race will dictate health outcomes. That's not true. Black people cannot be trusted when explaining symptoms or following medical advice. Certainly not true. Black people exaggerate or have a higher tolerance to pain. Or Black people are drug seeking. None of this is true. What's very interesting is when I've talked to my students, they have told me horror stories of how themselves or relatives have not been believed when they've presented with symptoms. Oh, that can't possibly be true. And, you know, it's very, very disheartening. Perhaps many of you saw the video, My Name is Dr. Susan Moore. And here she is a family practitioner, hospitalized for COVID, sadly, ends up, you know, succumbing to the disease, but how she wasn't even believed by her own physicians. And then the last bullet here is an interesting one. It's, I hope no one in healthcare personally believes that Black people have different blood. But this is, and you know, if my husband's still on, he'll, you know, he relates the story. My home community was Frederick County. And we were doing a series of talks at the library, and one of them happened to be on race unity. And we had this gentleman come there that some people knew and recognized as being a member of the Ku Klux Klan. He may have been even the Grand Dragon. And after the talk, he came up and he found out that one of our community members happened to be a physician, and many of you may have known Dr. Naheed Sabani. And he came up to her and he started sharing with her a story of his mother who had been recently hospitalized. And in the conversation, he said to her, you know, we were just so grateful that my mother was able to get white blood. Well, if you know anything about Naheed, you can probably see her face, and she got this rather quizzical look on her face and this expression of, you know, what are you saying? And, you know, I guess he complained, well, no, he got white blood. And, you know, in her very loving and beautiful way, she clearly and calmly explained to him that, yes, there were different types of blood, but it wasn't Black or white blood. Well, as I understand it, and as it was relayed to me, the gentleman took this information in and said, I never knew that. This illustrates a point of ignorance in the fact that this was knowledge this gentleman didn't know. And he was, because of perhaps his biases and prejudices, made an assumption that was not true. But what also was significant about this interaction is he took this information in and realized he had been wrong. And so there was not this commitment to ignorance at this point that we see so much when it comes to racism, and is the definition that I love, which is that commitment to ignorance. So that through education and exposure, we can begin to right these assumptions. And I think all of us have a responsibility to call out when we see that people maybe unconsciously do these kinds of things and make these kinds of statements, which of course are not founded in fact. So if you're not familiar with the New York Times' 1619 Project, I encourage you to look at some of their articles. And they published this one in 2019. Myths about physical racial differences were used to justify slavery, but it's the rest of this title that is so disconcerting and are still believed by doctors today. We all come with unconscious and implicit biases. And of course, you know, through our own self-reflection, trying to identify those and weed those out. But it is, you know, a fascinating look at how historically these have developed and how they are still being perpetuated today. Well, kind of relating to my own profession, as Cheryl Lynn mentioned, I am a dietitian. And we know, and this is where, you know, my concern has, of course, come from, seeing how diet can really contribute to chronic disease. I do feel that, you know, good nutrition is the foundation of good health. And so in order to really address these health disparities, it's important to understand how these factors, including diet and nutrition, contribute to these disparities and what can be done about them. And so there is a lot of work within the nutrition community looking at this, but it's much more systemic and goes much deeper than doing some little research project. And it gets to other issues that impact health in the Black community. And we used to talk about deserts, food deserts, but that really did not get to the true nature of the issue. And so recently, the phrase food apartheid has been coined as the root of the problem with America's groceries. It's not enough to just get a grocery store in your neighborhood. And so this actually was published in The Guardian, which is a British publication, but it interviewed a food activist by the name of Karen Washington. And she says, you know, I am fighting for food justice, and I don't like this term food desert. It doesn't take into account the systematic racism permeating America's food system. And if we're really talking about improving somebody's health, then we have to talk about the food that they're eating. And she talked about what was needed to make these positive changes was an influx in resources, monetary help, to, again, increase urban gardening, which is a growing movement, especially among the Black community, and create more local ownership of land and capital. And she helped found an organization called Black Urban Growers, which supports and advocates for Black farmers and Black leadership in the food movement. There is another urban gardener out in LA area, and he would use this analogy of going through a drive-through fast food restaurant is more lethal than a drive-by shooting. Think about that for a minute. Going through the fast food drive-through is more lethal than a drive-by shooting in the Black community. So why is the need for a Black Urban Growers Conference? And the idea is that we talk about diversity, but we've got to have diversity in our food production sector as well. We don't nourish the soil and diversify the seed, it leads to depleted nutrients in the soil, and it leads to a desert. If you've ever followed the food movement, you know it's predominantly white. Where are the Black farmers? And if we don't think about planting seeds of diversity, when will we get that new blood into the food system? Or what will happen is it will become a desert. Now, one of the things that I find particularly interesting and really important is in terms of food apartheid, you know, and looking at, of course, what happened in South Africa for so many years, is also the lack of understanding indigenous foods. And if you think about the foods of the Black diaspora, leaving, African diaspora and leaving Africa, coming here, what foods were brought to the New World that got incorporated into our diets, but also had gotten forgotten. Now, I talked about working in Selma, Alabama in public health. I was a WIC nutritionist. And one of the things that I noticed and really enjoyed is when I was working with young girls who were pregnant, I found that those girls who still lived or had influence by their grandmothers often had the best diets. They had the greens and they were, really fed very well because their grandmothers were going back to some of the more indigenous foods that were part of their original heritage. And you can see this pyramid here, which shows that the foundation are greens, which are some of the most nutritious foods you can possibly eat. And then you build on them lots of fruits and vegetables and legumes. You don't get to meat until very top. And while we talk about eating off of a plate, the idea is the foods at the top of this pyramid are the ones that you have in smaller and smaller amounts. And so the idea is getting back to fruits and vegetables, whole grains, and legumes and things that are not heavy in salt, not heavy in saturated fats, and of course we know boost our immune system and help keep our cells healthy. Back in the 60s, there was a researcher by the name of Burkett who went to Africa. And one of the things he noticed as an epidemiologist and researcher was that there were very low rates of colon cancer. And so he examined the diet of Africans and found that they ate a lot of fiber. And if you look at this pyramid, you can see a lot of high fiber foods at the bottom, which are to be the foundation of the diet. So he came up with this theory that high fiber diets help to reduce colon cancer. He comes back to the United States and decides, test out this theory. So from the 60s, we've been doing all sorts of research and looking at fiber and colon cancer. But when you look at the research that's done in the United States, you find it's all over the place. Some studies say, yes, it does seem to lessen the risk. Other studies were inconclusive. Well, then it suddenly dawned on somebody that, well, maybe it's the kind of fibers people are eating. And again, this gets back to these indigenous diets. What are historically the foods that we as man evolved from? And is our biology really designed more to get the most of the benefit from these, what we'll call natural foods? Some people call it clean eating. Some people call it just less processing. But we know that the more simple and closer to the origin of the food, usually it is the healthier. And when you look at this pyramid, you see that if we can get all of us, but especially minority communities, to look at what is their indigenous diet, what is the diet that we all evolved from, and that is probably the healthiest food. Well, as you can see, it's lots of fruits and vegetables. So getting back to this concept of farming, we know that we need to be eating foods that are close to the ground, that are close to the way they are when they were grown. So there's a whole movement in looking at the African Heritage and Health Program and learning how to cook with these foods. And we held, I had a group of students and we held this program at UMES a number of years ago. And we got all sorts of participation of people who had, wow, I heard about this food, but I've never really tried it. I didn't know how to cook it. And so there was a lot of interest in appreciating the skill of being able to eat foods which are indigenous to our ancestors and are ultimately the healthiest. So the next question is, going forward, are we making progress? Now, what I'm going to do is give you a series of examples of where I think we're making some progress. I'm also going to show you snippets from an article that was recently published in the Washington Post. And I'm going to let you make the decision as to what you think about this, because I'm not sure. I can say, yes, I think it's progress, but I would be more interested in knowing how you interpret what is going on here in this dialogue. So we look at unconscious bias. It's there, but we're not aware of it. And how do we bring that to the forefront? And so I'm going to highlight some things of ways we're trying to do that. So there was this post in article in the Washington Post, early February. And one of the problems was the lack of health services and transportation impede access to vaccines in communities of color. Again, the disparity has now impeded our ability to vaccinate a community that has been disproportionately affected by this pandemic. So what do the experts say about this? Now, this was just after the Johnson & Johnson vaccine was being approved for emergency use. So public experts, physicians, civil rights advocates, they say that we must pay attention to the practical barriers that fuel these disparities and have become a hallmark of the American healthcare system. So now you've got people publicly saying this. So yeah, we've known about it, but now we're acknowledging it. And it's because these obstacles continue to stymie efforts to bridge a growing divide in coronavirus vaccinations. And if there is a positive thing with the pandemic, at least it's shining a bright light now on these disparities. It is helping us know the structural racism that exists within the healthcare system. And what has happened, it's found the gaps. And so now we know where we need to work. When I talk to my students in community nutrition and we talk about projects and we talk about what does the community need? What is the grassroots feeling of the community members? What do they need? Not what we think they need, but what do they need? Where are the gaps in services? Where are those pitfalls that are impeding us from getting health care to everyone that needs it? And the statistics, as you know, are very grim for Black Americans. 1 out of every 645 Black Americans in this past year have been affected by COVID. I have students who have been in and out of quarantine so many times, they refuse to even come on campus. I teach remotely, protecting everyone. And sadly, we've had students who have lost not just one, but maybe several family members. But they understand the seriousness of this epidemic. And on campus, we've had a very, very relatively low infection rate because they've taken this to heart and they understand what they have to do to protect themselves and their families. So what do community members say? Community member used to have a neighborhood pharmacy where they could get their prescriptions. And maybe now, if it still existed, they could get their COVID-19 vaccine. However, the pharmacy closed and was replaced with a private dialysis center. The irony was not lost on the citizen. Now, I don't know how many of you know about chronic kidney disease, but there are 2 big factors. One is diabetes, and uncontrolled diabetes is one of the leading causes of kidney failure in the United States. Diabetes is caused often by being overweight and having a very poor diet when you're looking at type 2 diabetes. Those are some of the factors that underline developing type 2 diabetes. So you close a pharmacy, more difficult for people to get their medication, more difficult for them perhaps to be able to control their blood sugars. Who knows what kind of grocery stores are available, and you end up replacing it with a center which is private, and that's important to understand. Dialysis centers are a big moneymaker nowadays. When we know if we could have medical insurance cover nutrition counseling at stages 2 and 3 of chronic kidney disease, we could reduce the number of individuals that end up on dialysis. So in March 1st, after Johnson & Johnson got its emergency use approval from the FDA, there was a discussion about what do we do to hard to reach communities and make practical sense about getting this vaccine to them. And so what I'm going to do is give you a look into the dialogue and the discussion that surrounded the use of the J&J vaccine. The Johnson & Johnson vaccine, for background information, is a one-dose vaccine. And it has been found to be around 80 to 85% efficacy. Not as high as the Pfizer or the Moderna, which were previously approved, but required and do require 2 doses. One either 2 weeks apart, and the Moderna, I think, 28 days apart. So the concern was, but they could drive perceptions of a 2-tiered system. Riven, which means, this horrible divide along racial or class lines, which marginalized communities getting what they think is an inferior product. Now, ironically, in our community, one of the Black members of our community just got the J&J vaccine, and she was thrilled with it. But now let's look at what the discussion and dialogue is. And my question to you is this progress? Or is it the same old stuff? And again, I'm going to let you make that decision. Okay. The apparent differences, Baker said, could nonetheless create uncomfortable questions for state and local leaders promoting a new vaccine to people who might ask, as one person paraphrased it, why didn't you give us the good stuff? And this is the governor of Massachusetts making this comment. North Dakota governor was quoted as saying, vaccine hesitancy, but the potential for brand hesitancy as well. J&J is going to be challenged for all of us to be able to implement. And if we end up with a hierarchy that says all rich white people get Pfizer and all poor Black people get J&J, that would be a problem, said Helen Gale, who's the president and chief executive of the Chicago Community Trust. The easier storage and scheduling requirements for one-shot position make it ideal to penetrate hard-to-reach populations, such as those without housing, transient groups, including people moving through the criminal justice system. However, the rub is that people of color are often overrepresented in all of these populations. Bittinger, the medical director of emergency preparedness at Mass General, Brigham and Beat Boston, also emphasized the remarkable performance of all 3 authorized vaccines, but he cautioned against papering over possible differences. He actually uses the word equity. But is this unconscious bias at work? Equity means assuring those who have suffered most from this pandemic are clearly able to access the most effective therapies with the data that we have at the time. But he also went on to say, and this is where the assumption comes on in this unconscious bias, communities of color or hard to hit communities are more in need of a single shot regime. Wait a minute, he says. These communities have demonstrated that they can handle the logistics of cold storage and the execution of 2-shot regimes. Aha. So again, oh, this is too hard. They can't handle that. Well, that's not at all true. Again, these myths, this unconscious bias at work, even when we're trying to be open and aware. So what does the data say? Richard Nettles, who is Vice President of Medical Affairs for Johnson & Johnson's Janssen division that developed the vaccine, says it was tested at the height of the pandemic globally and included significant numbers of participants from South Africa, where we have those a threatening new variant. The vaccine was found to be more than 80% effective at preventing severe illness in South Africa. And it is a performance that stands out because the other two vaccines authorized in the US have not been tested against these variants, but the J&J had been. So this is what the CDC has said then, from a public health standpoint. There is disagreement about how to do that, however, especially about how much detail the public needs to know, all right? How do we make a clear and transparent message about the Johnson & Johnson vaccine? The former official said we should be able to craft messages that make it clear you're not getting an inferior product. If you're getting the Johnson & Johnson vaccine, you are getting vaccinated. And as I said, the member of our community who happens to be Black was thrilled to get her vaccine. Gail, the former CDC official, also went on to stress that the communal benefits of vaccination is what's important. That we know that the more people we can get vaccinated, the better we are to fight against these variants, that we can crowd them out. And what is also important and was noted in that presentation I heard through the Chair for Peace at University of Maryland was we've always used this term herd immunity, talk about herd immunity. Well, that does imply sort of an animalistic, we herd people, and that doesn't have the most positive connotations. So it's really probably better to talk about community immunity. And as my husband shared at dinner with me, an Indigenous way of looking at health is that if you're healthy, then the community's healthy. The idea is that we can take care of, I can take care of you by taking care of me. And that when I'm healthy and I'm part of this community, I'm helping to make the whole community healthy. You talk about the commonweal and the commons, and that is what, sadly, is another division that perhaps we've seen during this pandemic, that we don't understand our individual rights and then our rights to the other person. And of course, from a Baha'i perspective, we realize our lives are dedicated to serving others. And if we take care of the needs of others, we know our own needs will ultimately get taken care of. And how better to illustrate this than getting a vaccination, which yes, protects me, but also protects my community. Because we all know that there are people in our communities that cannot get vaccinated for various health reasons, that it's not safe for them. And so we have to take that responsibility if we are healthy enough to get that vaccine, to protect them and to protect those who are unable to get the vaccine. So what does the future hold? Well, here are some of the things that I think are interesting. There is an advisory committee within the USDA on minority farmers. And if anybody's been paying attention to the last COVID release bill that just got signed by President Biden, it has money in it to help support minority farmers during this very difficult time. So there is provisions in the current bill to protect minority farmers. You have health equity and minority health divisions within CDC. And one of the things that's been a great concern is that when we do studies in healthcare, it's usually been on older white men. Women were left out and minorities, different ethnic groups were left out. And so there is a whole division now on minority health and looking at health equity, which means it is action for justice. Within the CDC, they have these conversations on equity, and that people are constantly blogging about their increasing awareness of these health equities. So there is definitely an increased awareness. And what we hope is that this is sustained And so as individuals, we have a responsibility to keep people's feet to the fire and make sure that these issues remain in the forefront and remain visible and are addressed. Other hopeful signs in education. This is taken from a webinar that I attended, which was out of Tufts University, Friedman School of Public Health, talking about health disparities and teaching future healthcare providers and community workers and food activists about the problems that are faced by different racial demographics and how, in this case, big data may have a role in helping to attenuate these disparities. These are current bills that are right now in our own Maryland legislature. Implicit bias training, which I have gone through from our Minority Health at the Maryland Department of Health, but sustain that funding. The other bills are Maryland Commission on Health Equity, and another is the Maryland Health Equity Act, which will provide resources to communities in the state of Maryland to help promote primary care, prevention services, reduce healthcare costs and hospital admissions and readmissions. Again, when we serve everyone, everyone benefits. NIH Library has a reading club, Racism in Health. And if you haven't read Black Man in a White Coat, I really encourage you to do this. It's an excellent book. It came out in 2017. There have also been some other recent books published by Black physicians talking about, their challenges with health equity and disparities. But, Dr. Tweedy grew up in Baltimore area. He went to the University of UMBC. He went to UMBC as undergraduate and then went to Duke for his medical training. And so we're going to listen to a little bit of an interview that was done on NPR with Sherry Gross a couple of years ago. And then there is in my own profession, and I want to take a minute to talk about this because this is a tremendous concern. If we believe that nutrition is the foundation of good health, and we're trying to get this message out to people, and we go into communities where they look like me or, an older white woman, the idea is that we need to look like the communities we serve. And that is so important. And there are so many barriers to being able to get a more diverse healthcare force. Unfortunately, you see a lot of diversity or more minorities in lower wage occupations, but they make the biggest impact, and it's not fair. And so making it possible for people to get into healthcare professions, tremendous need for diversity, tremendous need. And especially in my particular profession, which has been predominantly white women. We've had one Black president, and she even experienced racial biases, even as president of the Academy of Nutrition and Dietetics. So there is a lot of work yet to do. But we understand that we need to address racial and ethnic health disparities and the impact on chronic disease. To summarize, let's hear from Dr. Tweedy. And so I'm going to stop sharing, and we're going to listen to about 3 minutes of this interview with Terry Gross.
This is Fresh Air. I'm Terry Gross. Is being Black bad for your health? It seemed that way when Damon Tweedy was in med school, and most of the diseases he was learning about came with the warning that they were more prevalent among Black people, and that the outcome was worse for Black patients than white ones. Dr. Tweedy is Black and was himself diagnosed with chronic health conditions in his 20s. He's written a new memoir called Black Man in a White Coat, a doctor's reflections on race and medicine. He's a graduate of Duke Medical School and Yale Law School and is an assistant professor of psychiatry at Duke University Medical Center and a staff physician at the Durham VA Medical Center. He was raised by working-class parents. His father was raised in rural poverty, didn't finish high school, and worked for 35 years as a meat cutter in a grocery. Tweety's mother went to segregated inner-city schools and couldn't afford college. Tweety was given a full scholarship at Duke, and one of the issues he examines in his book is affirmative action. Dr. Damon Tweety, welcome to Fresh Air. So when you were in medical school, and every time one of your teachers was talking about a disease and you'd be told it's more common among Black people, what did you initially make of that?
There was a part of me that really wanted to find out the answer. I mean, so there was this one part that thought, well, is this just all genetic? Is this based on class? Is this an economic thing? What is it all about? And I was just dissatisfied to almost feel as if I was not getting an answer. So that was really part of the struggle that I dealt with.
And do you feel like you have an answer now?
I think I do. I think I have a much better answer than I did then. It's almost best to think about it. There's several examples that I saw along the way that really really underscore what's really going on. One time early in medical school, this is probably my third year, basically we volunteered at a rural charity clinic. It's about 90 minutes from campus, and the patients there they're all African American. They didn't have health insurance, and it was pretty clear from the beginning that you're just delivering a lower standard of care in the sense that, I mean, the doctors are doing the best they could, but the patients often couldn't afford the medications and the lab tests and all the other treatments that they needed. So that really was a real stark example of how Black people in this particular case really could face worse health problems in a really obvious way.
Mm-hmm. And another?
So I think there's this issues at the system level. Then there's another layer when you're talking about the doctor and the patient and how they interact, and so the issues around trust and communication. So those are really important, and the sense that the patient has that the doctor and patient are partnering together, to improve their health. So there's been a lot of things that have happened in the past that have really still impact the present. There's been a long history of African Americans being mistreated by the healthcare system, and even though it seems like a long time ago, for instance, the Tuskegee study ended in 1972. That's over 40 years ago, but a lot of the people are still living from then that were around back then. And I think for many people, there's sort of this residual mistrust that often can manifest itself. I'll see patients now have diabetes and high blood pressure, and they're wondering, are they getting the right treatment? They're feeling like maybe they're getting some kind of lower level of care, when in fact, oftentimes they're not. So that's another real important issue that's at work.
So let's get to a kind of complicated case that you had to deal with.
So let me conclude. And this is the book. By these quotes from the Baha'i faith, and I ask the question, as Abdu'l-Baha did, is it just for some members of the family to be well and comfortable while others are in abject misery and poverty? The disease which affects and afflicts the body politic is the lack of love and absence of altruism. Without these, there can be no progress or prosperity. When the racial elements of the American nation unite in actual fellowship and accord, the lights of the oneness of humanity will shine. The day of eternal glory and bliss will dawn. This is how we achieve the ever-advancing civilization. Joy brings us wings. Thank you.
All right. Thank you so much, Malinda.
Well, thank you.
We've got a ton of stuff to unpack.
Oh, a lot of info. It was just a quick overview, really. There, you could take each issue and really get into it with much more detail. But thank
I'm
you.
sure. Can we get back on speaker view or spotlight, please? Are we there? There we are. Okay, I was just in the wrong spot. Okay. Now I can see you. Great. Okay, friends, we're gonna do two things now. We're gonna open the chat. If you want to put comments in there, if you'd like to speak, please raise your hand. Not visually. I actually figured out how to find the little hand raising button and to find it and know when someone wants to say something, and it does appear in order. So I won't be taking anyone out of order. But let me first ask if, okay, Winnie's up. All right, Winnie, go ahead. Come on off mute there. How are you, Winnie? Can't hear you yet. Hang on, you're still on mute.
There it is.
There we
My
go.
background is as a nurse and lactation consultant, and I worked in OB for a number of years. One of the things that I saw there, the hospital I worked at had a level 3, the highest level of the neonatal care unit. And the attitude that I heard there was that, well, you know, Black babies born at 37 weeks are as mature as white babies at 40 weeks. They seem to mature sooner in the womb. And I thought it was crazy at the time. Since then, I've learned about the problems that these near-term babies have. They do great at first, and about a couple of weeks out, they crash. And so if the attitude is that, well, the Black babies that are born a couple of weeks early, no big deal, you know, then if the mother has concerns, you know, is she going to get help that couple of weeks out? Is that one of the reasons that neonatal death is higher? It always kind of bothered me that may have been a factor in that. The next thing too is the idea that because Blacks supposedly don't feel pain as much, therefore when they ask for pain relief, that proves they're drug seeking. Was the attitude.
Yeah.
And another thing that I noticed is the whole idea of sleeping with your baby. You know, that's been downplayed, and yet research has shown that if done correctly with guidelines, it is better for the baby in many respects. And when we tried to get the local health department to back off a little bit on this, it's terrible, never do it, and we're presenting them with that research. Well, you know, some people just can't understand those guidelines, so it's better for us just to say, don't do it. You know, that to me was appalling. And then the only other thing I wanted to mention was the Henrietta Lacks story.
Yes. I didn't mention that, but
was it racist? Was it just that she happened to be? What it was they got tissue from this woman with cancer, and it turned out to be tissue that would keep replicating itself, and has been used for many, many studies. In fact, even the polio vaccine is thanks to the Halo Henrietta Lacks, you know, the 2 letters from her names, and yet the family never received any recognition. They have now, the family is on the boards deciding how those cells will be used. So at least that has been done. But that was another example of probably racist medicine.
Oh, I'm sure. Thank you so much. Those are wonderful examples. And having been a lactation consultant myself, one of the things that really disturbed me was a woman would come into the pediatrician and be having difficulty, and the doctor did not either have the training, experience, or time to work with her, and would immediately say, oh, stop breastfeeding, just go put the baby on formula because I can't afford the baby to lose weight and to die and things like that. And so again, when you lose that grandmother wisdom, you don't have the support in any community, but especially in the Black community. And so in working in, you know, Alabama, you know, we were really trying to inspire and trying to encourage, you know, our WIC participants to breastfeed and all the advantages there, but they didn't get that reinforced, sadly, at home or with their peer group. Now, North Carolina came up with a wonderful solution, is they started doing through extension, through, you know, extension service, training what they call peer lactation support. These were women who had already nursed. They were lay, they were not professionals. They were just like their neighbors, but they got hospital privileges, and they were able to prove to the physicians that they were giving support. And so now the doctors would simply say, oh, you have a lactation consultant, you have someone you've been working with. I'm comfortable, continue, you know, I'm not going to tell you to stop breastfeeding. And that seems crazy, but that has even changed in the last 30 years, the attitudes towards, you know, pediatricians and breastfeeding and being able to continue to do that. And again, the skin to skin now that is done much more in the hospital. You know, even regardless of whether you're nursing your child or formula feeding with a bottle or using a bottle with express milk. But we know, sadly, that when we look at obesity rates among different, you know, groups, overweight women, and many of them, many Black women come into pregnancy overweight, have higher risks for pregnancy and delivery. And one of the things that's very interesting is that we see less nitric oxide in, which is a vasodilator, which keeps that umbilical cord dilated so that there's plenty of blood and nutrients getting to the baby. And in overweight women who are pregnant, there is less of this. And so there is concern that you have some constrictions of the umbilical cord during pregnancy, which limits the growth of the baby.
Wow.
And so here you have an overweight woman, which you would think would give birth to an overweight baby, and they end up either delivering early or have small for date babies because there are these, you know, health issues that nobody's really aware of going on. So
Wow.
you're right.
Thing too that entered into that was the attitude carried down from slavery, because slave women had to nurse the master's babies. In fact, that took priority over nursing their own babies.
Exactly.
And it left an attitude of, you know, we don't do that anymore. We've come away from slavery. And so there was that attitude in some aspects of the Black communities, especially from the grannies and so forth, that, you know,
And
you shouldn't do that. We don't have to do that anymore. That's in the past.
you're absolutely right. And there are a lot of books written on that. And sharing a little bit of my own family history, I had a great aunt that lived into her 90s. She was one of the first women to graduate from the University of Michigan Medical School. So she was a medical doctor in the early 1900s, but her mother died at childbirth. And this woman smoked like a chimney her whole life. She lived well into her 90s. She had incredible healing property. And I will swear on a Bible, she told me that she had a Black wet nurse and attributed her good health to the fact that she had a Black wet nurse when she was, because her mother had died at childbirth. And this, you know, they're.
Wow. Wow. Fascinating.
Yeah.
Fascinating. I don't know what to say on that. But we'll go to Ed Young, who's up next with a question or a comment. Edward?
Yeah, aloha from Hawaii. Thank you so much. Even though I have a picture of the Golden Gate Bridge, I'm from Oakland, but I'm Hawaii. But thank you so much. This has just been phenomenal. And I just think of you know, the sort of the common quote that what you eat will kill you. And so, you know, eating is fundamental to living. It's drinking water and, you know, taking care of oneself. So to me, that you've just given us, at least to me, and my daughter is studying to be a nurse in St. Louis.
Nice.
And she's focusing on babies. See, so yes, thank you for really bringing insight into this, really the disparity in our system and this healthcare that is fundamental to who we are and what we are, you know, what we do. So thank you.
Thank you, Ed. Okay,
Thank you.
I have a question for you, Malinda. You mentioned one of the earlier slides that one of the assumptions or myths that Black and whites present the same way with certain health issues, when in fact they do not, correct? Yeah. Give some examples of that.
Okay, now I'm not a medical doctor.
Oh, you know.
So, just like men and women present differently with heart attacks, and you know, I think blood pressure issues sometimes that's high, but you don't perceive that you've got high blood pressure. And I know that sometimes different medications react differently in different people. And again, we also know that in Black women, there's research that shows that the response to exercise is different.
Oh, can you elaborate on that a little bit?
Well, that some, it doesn't, and again, this is not across the board, I'm sure, and who knows, but that they found that where some individuals will really get a big calorie burning effect, it doesn't seem to have the same calorie burning effect.
For who? Who
Yeah.
has less of a calorie burning effect?
They found it in certain overweight Black women. Now,
Okay.
there also gets into appetite hormones, and we know that just being overweight affects the way that our brain
Mhm.
and our hormones work. And so actually hormones that normally would tell our stomach we're full are short-circuited the heavier we get. So we don't get that natural satiety that normally occurs. It's just fascinating. It really is. And we know that, there's not just one gene that affects our weight. I mean, it's been estimated there are at least over 300 genes that affect our weight. But this was one study that was looking at the biological reactions to exercise and found there were differences among different people, that we respond differently. And we all know that we have either short or long twitch muscles, and if you're a sprinter or you do distance, and again, the thing is, when you go to Africa and you look at all the people that live in that continent, everybody's different. I mean, diversity is everywhere. There's not just one body build or body type. And
Right. Now, I think when you and I were talking, you mentioned something about melanomas, right?
oh, I forgot about that.
Did you
Thank
talk
you.
about that?
Yes. Thank you for reminding me, because I did not put that in my slideshow. I was listening to an NPR presentation on tech data, and they were talking about machine learning. And you're all familiar with that, where machines just start to, I mean, we see that all the time when we get, you're looking at something and you've been reading something, and then suddenly an ad will come up and say, oh, this is what you like.
Mhm.
Well, one of the ways that video machine learning has been used is in the area of dermatology. And they would scan a person's skin. Now, you've probably heard it in terms of criminology with face recognition, right? And the big controversy about, well, how many times can you actually get a true face recognition? Well, we know that the darker your skin is, the more difficult it is to determine who you are. That facial recognition does not work with dark-skinned people. Well, one of the concerns with melanoma, skin cancer, is that there is this myth or assumption that Black people don't get it because your skin's already dark and you're already protected against UV light because you have dark skin. And also the fact that it's hard to detect in darker skin. And with this facial recognition, if they're using it to detect any kind of melanoma, it's not picking it up. And so you look at the statistics and you see, well, why do more Black people die from melanoma or have more severe cases of melanoma?
Mhm.
Well, it's because it is not diagnosed until later, stage 3 and stage 4. So many times, because of this issue of not being able to recognize it properly in a dark-skinned person, and if you're using some kind of video technology to diagnose it, it's not picking it up that well either. And so again, this is, you wouldn't think about it. So it's not that it's worse, it's that we are not diagnosing it early enough because we are not aware and attuned to the need to be more careful in our diagnosis. That we're relying on technologies that don't provide us the information we need.
Mhm. So the
And we're making
technology-
assumptions about dark skin color. You're protected because you have more melanin and you've got, protection against UV light. And of course, that gets back to the whole reason of why are people during the equatorial, who are originally from the equatorial zone in the world versus somebody who's closer to the poles, has darker skin. Well, it's a protection because we know that hormonally we make vitamin D, and vitamin D is needed. It's a really important vitamin and hormone, but it can also be toxic. And so it's the body's way of protecting against getting, too much vitamin D. The irony is, breast milk is not particularly high in vitamin D.
Huh.
I think biologically, the assumption was that you would be exposed from birth to sunlight as well as get it through nutrition. And so again, protection. But in the African American community, when I worked in North Carolina, we were finding Black babies who were breastfed deficient in vitamin D because they were not getting any sun exposure. And again, we've been concerned about cancer and skin cancer, so we don't let kids go outside very much without slathering them with all sorts of
Mhm.
sunblock. And so now it routinely breastfed babies are
Okay.
supplemented with vitamin D from birth. And in North Carolina, in WIC, when I worked there as a WIC director, we were giving out to all of our breastfeeding mothers vitamin D supplements. As again, North Carolina has been on the cutting edge of a lot of public health things, but
Mhm.
these were diagnosed there. And we haven't seen rickets. I mean, rickets is, a disease that was during the, Industrial Revolution, and yet it was cropping up in the 1990s in the United States.
Wow, that's amazing. That's amazing. Okay, Kenton has his hand up. Kenton Dunbar, come on off mute.
Hi, how are you? Great to
Thank you.
see you guys, and fantastic presentation. I only got in on the last 20 or 30 minutes, but extremely helpful and extremely informative. Excellent. Thank you very much.
Thank you.
I just wanted one quick question. I came into the faith back in 1966 in a health food store in Palm Springs, California. And that kind of set my life straight in terms of eating habits. And I remember at one point I got so enthused about the possibility of nutrition that I was looking for some way to get involved in some way. And at that particular time, health counseling and nutrition counseling, really 60s, that wasn't quite on the agenda yet. So I decided to, one health specialist told me, go check into chiropractics. So I went to the Glendale Chiropractic School in Southern California, and I'm just, asking what the requirements are. And they wanted 1,600 hours of nutrition study to get their degree. And about a month later, I found out that to become a medical doctor, you're required 100 hours of nutrition to get your MD. I just wondered very briefly, has that changed at all? Thank you. I'll take my answer on the air.
In some medical schools, that has changed, and dietitians are teaching those classes, and it is becoming more and more a requirement. In fact, there is a practice group within my discipline of dietitians that teach other medical practitioners. One of the things that we chuckle about is the new buzz in medical is that food is medicine. Well, we've been saying that for a long time, food is medicine. But what I think is very important, and really your question helps me bring this up, is that now hospitals are actually providing food for patients when they leave the hospital.
Really?
In other words, we are assessing patients' ability to access food once they leave the hospital, because we know that if we send them home and they're not well nourished, they're going to be right back in. And so again, it's done on a needs basis, I think, in most cases. But this is, hospitals have really been trying to work very closely with food banks and become a distributor of food for patients, so that when they leave the hospital, they know that at least for a while until they can get on their feet, it's part of their, discharge planning, that they are provided with food to be able to stay nourished and heal, because we're trying to get people out of the hospital as quickly as we can, and not because we're trying to shortcut their care, but we know the longer they stay in there, the more apt they are to catch like a nosocomial, which is a hospital-caused infection. And really, there are lots of reasons to try to, from a health standpoint, not just from a monetary standpoint, to shorten their length of stay. But we realize that without good nutrition, they're not going to heal. And so this is a new emphasis. We've encouraged physicians to write a prescription for exercise, or for, water as a beverage, not your soda, not even your, diet soda, or things like that. Because again, in many patients' eyes, the physician is still the authority figure, even though, you know, they may defer to us. What I've seen, though, and it has been a really wonderful thing, is that, you know, my relationship with chiropractor and the support they have given our profession, and also the respect and support I've gotten from doctors now that they see, and pharmacists as well. And I used to lecture UMES as a pharmacy school, and I would do their nutrition lectures for many of the pharmacy and PT students. So we're trying to integrate and make sure, at least at UMES, that nutrition is integrated across all of these healthcare fields, even though we're stuck in the School of Agriculture and Natural Sciences because we are about food. And I'm all about food, and I grew up on a farm. But, you know, we walk that line between food and health. And so, you know, it's an interesting occupation to be in.
That really is. When you talked about the hospitals, and Amir, you're next, give me just a moment. When you spoke about the hospitals just now, you know, looking at food availability, you know, after discharge, is that just locally, Maryland, national? What's the scope of that as far as you know right now? And then I follow up.
I think it's a national movement. You know, I'm only aware of what's been done in Delaware and Maryland, and
Okay.
Maryland has really supported it. But this is just, I mean, it's kind of had fits and starts, and many hospitals also have gardens, and, you know, lots of things like that.
Yeah,
Yeah.
better food.
Mm-hmm.
While you're in there. Yeah, a lot of it can certainly use improvements, that's for sure. And speaking of food, I just wanted to ask you if you could share with folks, and then we'll go to Amir, who's had his hand up. If you could share with folks what the Baha'i writings say about food, and its importance.
Well, as you know, the only prohibition we have, of course, technically is alcohol. But Abdul Baha is very clear on saying that the food of the future will really be grains and fruits and vegetables, that we will get away from the meat-centric diet that's so typical of our Western diet here in the United States.
Yeah.
And as someone who is a meat eater, I'm a flexitarian, I kind of eat everything. But the idea is that when we look at global warming quite seriously, and, you know, we've got the climate issues coming up in April and of course, Earth Day. And as Baha'is, we're very concerned about the health of the earth. The less meat we eat, the less carbon emissions. It does have an impact all the way through the food production process. And so, you know, the Meatless Monday is not a bad idea. Now, in other parts of the world, they need more protein. Here in the United States, most of us are not protein deficient unless you're elderly and you end up in the hospital. Yes, then you're malnourished, sadly. But we definitely need to lessen our meat consumption. And if you look at chronic diseases and even Alzheimer's, there's a lot of evidence to show that a diet that's more focused on fruits and vegetables and legumes as the source of protein rather than meat, especially red meats, you will see that there are improvements. And food seems to be the factor, not necessarily supplements. And, you know, using supplements can be very helpful when needed, but it's all the components of food that really interact and make a difference in our health. And so science is kind of catching up with Abdul Baha. And climate change is also pushing us toward that. Now, when you also look at what the population will be at 2050, 9.7 billion people in this world, how are we going to feed all those individuals? And I used to do a presentation on getting protein from insects and eating insects. In North America and Canada, the only two countries that typically have not had insects as part of their indigenous food. You go every other place in the world, maybe not so much Western Europe either, but, you know, insects can be a very significant and low-cost way of getting protein into your diet. Now, it can be as simple as mealworms that you grind up and they become a flour and you use it as a supplement. But when you think, how can we feed 9.7 billion people in the world by 2050? That's going to be a challenge. And we need protein, and lots of places in the world need lots of protein. The United States can afford to reduce its meat consumption, though.
Mhm.
Not that we're giving up protein, we're just looking at a different source. And it will have an impact on the health of the planet as well, and our own health.
Yeah, it certainly will. Thank you. Okay, let's go to Amir. Amir?
Hi. Thank you for this very interesting presentation and informative. I am actually coming from, I'm living in British Columbia, so for me, speaking about food, I'm still waiting for my food for the fast. So anyway, I just wanted to comment about racism and healthcare in British Columbia, where recently we found out that in hospitals where First Nation are coming to emergency rooms, the apparently the staff in the emergency room are betting about how much alcohol is in the blood of the First Nation, and that has been in several hospitals. And that's like last year, and there's been an investigation about that. So just to show us how, you know, after reconciliation in Canada and all these things, that still in hospital, and that's not the only problem that First Nation are facing in hospital. They are, as you said, they are less believed about what they are telling to doctors, and are sent away from hospital or more often, and many problems with, which is in Canada even a bigger problem than than Black people in British Columbia, even though we have both issues, just like you guys. So I just wanted to comment that. Wonder if that's what's happening in the States as well.
It could be. You know, living in North Carolina, we have the Cherokee Nation, and I know traveling there, of course, alcoholism is a great problem on the reservations in the nation, and they have billboards, and so you could understand, but it's so sad because it's automatically assuming that that is the root of all the problems, and of course it's not. And you know, drug seeking would be, I think, equivalent to that here in the United States. And making the assumption that that's, you know, a character defect rather than a symptom of a great, you know, physical and emotional problem. And the fact that there is no joy in this person's life, and they're medicating, and they're, you know, looking inward rather than looking outward. And it's, you know, to me, it's that symptom. And it's very sad because they're automatically going to make a judgment. Oh, if there's alcohol and this person can't do this, and they're not going to tell us the truth, and they don't really care about themselves. And all of that is going to impact the kind of care, because they're going to be assumed to be lesser. And so they're not going to get the kind of care that they deserve. And I think that's why Tweedy ended up going into psychiatry, because he realized that it was the emotional and spiritual health of people that really had to be ministered to. And, you know, that's what, when Baha'u'llah says, I am the divine physician, I have the remedy for the world. And, you know, I've given you these laws of the choice wine. And yes, there are, it's not, you know, when we go beyond moderation in any way, we often have problems. And I think that's what's sometimes a challenge in the food movement, that people become immoderate. And that can be either by, you know, just eating whatever they want, and in foods that aren't, we know, healthy, but also from a health standpoint, becoming, we call it orexia, like right eating, where it becomes so regimented. Food should be something we enjoy and eat in moderate amounts. And, you know, not to digress from what you were saying, but getting back to your situation, it's the same thing. But if your environment's toxic, if you're surrounded by just, bad food choices or alcohol or whatever it is, then that's what you're going to end up, being attracted to, is a way to provide that inner comfort. And so, Baha'u'llah saying it's the spirit and my words are the comfort, and, drinking the alcohol or doing something else. But yes, you're right. I'm sure in certain areas, maybe they do that if alcoholism is a big problem. But I think here in the United States, it's more that they make an assumption about drug use. I don't know if anybody else would agree with me, but certainly the sad thing is alcohol is a big problem among indigenous people. And but it's a symptom, and the compassion we should be giving those individuals instead of judgment is the issue. So I appreciate what you said very much. Thank you.
Yeah, it's a very tragic history, and I'm sure you probably know, for our indigenous family, the introduction of alcohol, that blankets full of smallpox, that sugar and flour were the worst things to come into this country, into this land. And that legacy, is still being felt quite heartily for that reason. In fact, in Australia, the quote unquote Aborigines had a very healthy natural diet. And from what was available in the rivers and the greens off the land, despite being in what you might think of as almost a desert-like environment. And they were extremely healthy. They lived into their hundreds, quite healthy and well and alert and so on. And then with the introduction of people from Europe who brought them flour and sugar and changed their diets. And it's just been absolutely devastating. And that's true with almost any indigenous population. So the same things Malinda's talked about for African Americans in terms of diet, that applies equally as well. And I know in the Native American community in the US, there's quite a movement that has started to go back and find those traditional foods, working with nuts and seeds and berries and wild rice, and so forth and so on. So there's a lot going on there. Okay, we've got 2 hands up here. So let me check right here real quick. Who have we got? Okay, Winnie is next, but Winnie, I know you've gone already, so if you don't mind, I'd like to give someone else just an opportunity, and then we'll come back to you. Okay, Winnie? Ormond? And then Winnie.
Hi, Sherlyn. Thank you.
Hi.
Thank you, Malinda. This
Hi.
is very, very informative, and you presented so lovingly. Thank you so much.
Thank you.
I just thought a couple of thoughts. That this presentation, it made me, reminds me actually how mistrust has been such an impediment to the wellness, both physically and mentally, of Black and Indigenous people. And and with regards, you spoke earlier about the regarding the pandemic, how there's such a concern of mistrust, regarding these vaccines. I'm experiencing within my own extended family. I mean, there's a great number of I can tell you firsthand, many that are extremely apprehensive of taking the shot, getting the shots. And so it's a concern for me, but I just wanted to just put that out there. You've certainly, your presentation has reinforced some problems that we are facing.
Absolutely.
More of a comment than a question or anything.
Yeah, but no. And that's why the gentleman who happened to be Black, that was a professor at the School of Public Health with the University of Maryland, had gone to Tuskegee, and he also videotaped himself getting the shot, because he was trying to do that as a way of showing, here, I look like you and I trust it and I'm getting the shot. But you're absolutely right. And giving people all these reasons doesn't help them make a decision. I think it's important to open up a dialogue and say, well, what are your concerns? Share with me. Why are you concerned about this? And then acknowledging and respecting their concerns and hesitancy and saying, yeah, I can understand, how you feel that way. However, have you looked at the evidence? Do you understand, and then kind of go into, this is really not new technology, even though a lot of people think it is. It's been around for a long time. It's been used for Ebola and I think even rabies vaccines and things. And it does have emergency use. And so again, when all this was being developed, the people in power did not do a very good job of engendering trust by explaining the process. But it was, and even the name Warp Speed gave the impression that we were just rushing something through.
Yeah, it did.
And, I want to believe, and I think, even while the vaccines were being developed and the continued FDA approval, which is for emergency use, but vaccines have to, they're constantly vetted. But the idea is that there were no corners cut, and I really don't believe there were. And when you look at the number of people who have been vaccinated and look at the kinds of reactions, all are within the normal range of expectations of a vaccine. But we don't know how long the vaccine is going to be good for. We don't know how long our immunity will last. We don't know exactly how it's going to work with these new variants. We don't know yet if it's going to be something we'll have to have an annual booster shot for. Again, there are all these unknowns. And we know that even having the vaccine means that we could perhaps we still have to be careful, wear a mask, do all of that. And we can possibly have the virus not get sick ourselves, but pass it on. Again, there are these unknowns, but in terms of the safety, it is, met all those requirements. And I've lost a family member to COVID on Christmas Day. And sadly, that was like 3 weeks before his wife could get the vaccine. And you think, gee, wow.
Wow.
You have to just acknowledge that and ask them to share with you what are their reluctance, and then just kind of get them to sort of have this talk and see if they can work through some of those things. I have a neighbor who was very against it. And finally her sister said, look, I care so much about your health. Please get this. For me, I know you love me, and this is a gift I can give you to get you this appointment. And she finally got it. And she says, I wasn't sure, but I did it and I feel fine. And now I've got, at least I'm halfway there. She has to get her second shot. But I think acknowledging the fact that we understand it's okay to feel reluctant and scared and nervous about it. Let's talk about that. And maybe that can help open up and change their mind. And just tell them how much you love them and how much you care about them and how much you want them to be protected. You don't want them to get sick. But thank you. That's an excellent.
We must continue to fight through it, no doubt.
Yes, yes. Tell them you want that hug. Got to give up the hugs. Got to get back to the hugs. Okay. Winnie has some information she wants to share. And Winnie, would you like to go ahead?
Now, this is in regard to why there aren't very many Black farmers. Now, if you covered this and I missed it, my husband was trying to carry on a conversation when you were talking about that. But going back to which Africans were chosen to capture for slavery, and in some cases, it was those with agricultural experience that were priorities because most of them were used in agriculture here. And then after the Civil War, there was that promise of 40 acres and a mule, which didn't happen that much. But there were many, many of the freed slaves who went into farming, oftentimes as sharecropping. And of course, they wound up owing the landowner more than they were able to raise, which made a lot of them leave that. But then independent Black farmers had a very difficult time getting loans from the Department of Agriculture. because farmers many times have to take out a loan at the beginning of the year to be able to plant their crops. And then when they bring in the harvest, they repay the loan. White farmers would take something like less than a month, and it would take 2 to 3 months for the black farmers to get their loans, which interfered with their being able to farm. Different things that would seal the land from them. And so there are far fewer percentage-wise black farmers today than there were in the latter half of the 19th century. And if you just Google where are the black farmers, you'll run across several things that relate to that particular story and that piece of our history.
What I did show was the USDA Department of Minority Farming.
Okay.
And how this has been recognized in the last, probably since more so maybe since the Obama administration, but making the loan process much more open. And there've been many lawsuits too over this, where black farmers have come and said, whoa, 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 we see overt discrimination here. We've got to, redress. This has got to be redressed. And so there is this department. And I was also mentioning that the most recent COVID relief bill that Biden just signed into law does have a special area for supporting black farmers in providing them with compensation. And that is a specific part in the bill. It's not just farmers, but it's specifically minority farmers. So that was part of what I was trying to say, that there are things, afoot moving, and improving the situation. However, we know, looking at the last 4 years, that we can slide back and lose a lot of the ground and progress we're making. And so it is up to us to keep this issue in the forefront and continue to fight for racial justice, health equity, and bring joy to our lives.
Yes. On that note, and let me see, boy, you couldn't have timed that better. My goodness. Usually we, do the presentation part till 9, and we try to stop around 9:30, because we know a lot of people have to go at that time, but then we'll continue on for a little longer. Well, it's 9:29, Malinda. And that was just such a nice segue into this for us. And I have a question or two that I'd like to put out, to the whole group, so we can give your throat a little rest, take you off the spotlight, for a little bit, and kind of open this up for a larger discussion with everyone here. And that is, what are your takeaways from this? Whatever it might be, what you shut down Zoom, or you go to your next Zoom meeting, depending on where you are. But what are some of the takeaways that folks are having from this? And then in addition to that, does this open up new lines of social action for you, or maybe for your community? It's like, wow, okay, here's some place where I can work on, racial justice, in a way that feels really comfortable, or I can use an existing skill set or knowledge base that I have, in contributing to some of these things, but local in my community. People have any thoughts on that? Anything they'd like to share? We're off. I can see you all now. So as long as you're not hiding your face, I can see you wave. Wave if you don't want to do the hand raising. You got to wave like this, because I won't. If you just do that, I won't see it. So go like that. I'll see you. Anybody want to jump in there? Take your time. Get some more water. Fast really dehydrates us. I see people moving. Oh, good. Teresa. Hey, Teresa.
Hey, nice to meet you all. This has been a wonderful presentation. I work with medical students, and I have the task of preparing first and second years to go into the third and fourth year.
Wow.
So I am a Baha'i, and I've had a lot of conversation through the years regarding the message of Baha'u'llah and the oneness and unity and diversity. So what I didn't know was about the book club. And our young people are marching forward. They are answering to the call, and I'm being led to them. Incidentally, today I happened to be in Sally's beauty store with my daughter.
Sure.
And the woman working there was a young woman of Hispanic heritage. And she said she works 7 days a week. She was studying online full time. She was in her early 20s, maybe about 20, 21. And I said, what are you aspiring to become? And she said, a doctor. So immediately I grabbed her and I said, oh, we need to talk and I need to link you to others. Since then, I've been asked to be the diversity, inclusion, and equity director. And I've come to realize the power is at the grassroots. It's with our youth. It's with our young people. And the more they're educated and informed and given resources, the more excited I become each and every day. So having lived on Martha Root's property for 25 years and faced racism with my husband who passed away from Norway, it is very, very ingrained in me to do something about this. And I go to work happily each and every day. And I wanted to share that with my fellow Baha'i community. And thanks, Jean Marie. She's somewhere out there in the land for letting me know. I'll keep you all in my prayers. And thank you very much. Thank you.
Thank you for being here, Teresa, and sharing your story, and welcome on behalf of everybody here. We hope you'll come back. Yeah, if you want to be on the email list, just put your info in the chat there, and I'll make sure you get all of the notices and Malinda's slides. You know, we always send everything referenced. You get that back out again.
Thank you.
Email, and when the recording will be available. So welcome, welcome.
Thank you.
Where do you live? What city or state are you in?
I'm in Bradenton, Florida, which is near Jean Marie. We both served on the area teaching committee together.
Okay, great, great. Yeah, I saw Jean Marie. She's been busy in the chat.
It's nice meeting everyone.
In fact, on my screen, she's right next to you. You two are like this on my screen. So.
Aloha pa,
aloha pa, aloha pa. How about some other thoughts or comments? You know, you're so right, Teresa, you know, about the youth, you know, and it makes me realize how lucky Malinda is, you know, right? Because she's, you know, in a faculty position. She has access to all of these young people like you do. And that is a very, very important place to be in society. And we have that opportunity to provide them with, you know, really good guidance. And that supports the noble or aspirations of what they want to do in life. Anyone have any stories, aspirations, hopes, or possibilities of things going on in your community? Edward, I see you got your hand up.
Yes, it's just sort of a story. My as I said, my oldest daughter's third year of nursing, and you know, St. Louis University, there in St. Louis, and spent the semester in Spain at the SLU campus in Spain. And the white coat ceremony that they had was so impactful to the families. And it was really the personal story of one of the women on the faculty who shared that it's the nurses who spend the most time with the patient.
Yes.
Doctors come in and out. And so they said, you trust your instincts. If somebody is having a difficulty and the doctors don't catch it, be persistent to get their attention. So we heard this and we said, you're right, absolutely right. It's the nurses that really are the closest. So it's the nurse, you know, and those who help nurses. So anyway, I've never forgotten that speech, and I just greater appreciation now for those who support the medical professionals, nurses.
Yeah, thanks for sharing that. You know, you're so right. You're so right. I've been hospitalized a couple of times, one for a month, one instance for an entire month. And it really is the nurses. They are the ones, you know, that are really looking after you. And it's true, you know, the doctors, they come and go, you know, they'll even show up when you're asleep and not wake you up and tell you anything, you know. It's like, was he here? I'm waiting. Oh, he's been here and gone and left. You were asleep. What? You know. But yeah, nurses are phenomenal. You know, our mother, and I say our because my sister Regina is here too. Our mother was a nurse. And one of our aunts, I believe, Aunt Maybelline, I believe she was also a nurse also. And I really regret that I didn't have an opportunity to talk to her or to find out what it was like being a nurse. You know, she went to nursing school, I believe, in New York. And, you know, and graduated, and I have her picture with the little white cap. You know, nurses used to have the outfit, right? The white shift and the white stockings and the white shoes and the little white cap. And
so did dietitians.
Really? Dietitians too. Okay.
We didn't have the cap, but we had to have the white dress and the white shoes.
Yeah,
and
the white dress and shoes. Yeah, yeah. But I wish, you know, as a Black woman, you know, I had had an opportunity to know about her experience. But I always took pride in the fact she died when I was quite young, or relatively young. Oh, good, Regina's going to speak on it. But I always took pride in the fact in knowing that, you know, she had gone through nursing school, probably back in the early, the 50s, late 40s or so. And there weren't a lot of us. And she came from one of 13 children on a farm down here in Hebron, Maryland, right next to Salisbury. So I always felt very good about that. Regina, go ahead. What do you know? She's older than me, so she remembers stuff I don't.
Yeah, she had, actually she wore a blue cape. They wore a blue cape on their uniforms, and then the white hats.
Yeah.
But you know where she got pushback?
Where?
From her own Black principal in high school in Maryland, who said, why do you want to go to nursing school? Why don't you just get married? And actively tried to discourage her.
Wow.
But yeah, but she did it anyway. She never talked much about any kind of discrimination.
Yeah.
We grew up in Connecticut eventually. And she always seemed to have, you know, she went into private nursing for a while. Well, but she always seemed to have good positions.
Yeah, she was highly regarded, you know, when I was conscious of her as a, you know, a working woman. You know, at that time she was working in, this is when you went off to Stanford around that time period. She was working in a convalescent hospital, I recall, and usually night shifts, if I remember correctly. But yeah, it was something else. Any other comments, thoughts? What would you like to do if you had your druthers? Let's everyone get your own druthers, okay? Everyone, you got your druthers. What is it you want to do? Push, you can do it. What would you do in your community? What would you do? You know, put it out there, speak it. That's the first step sometimes, is a vision or a thought. What would you do in your community if you could? No obstacles whatsoever. We have to imagine, we have to talk about aspirations. It's okay if it's, you know, you don't see steps to something, that's all right. But we have to aspire, because your aspiration might inspire someone else. You know, your dream might be something someone else could see a way of doing, right? What have we got for each other? What can we share with each other here this evening? To take away, and to take with us.
If I could do anything, it would be to make the community more diverse.
But how? We got to be real specific. Be real specific. In healthcare or whatever area you want. Yeah, no, I'm talking specific stuff. If you had all the resources you needed, material, money, people, whatever, and you could do something in your community, what would you like to do? Is there something absent in your community that you would like to provide?
I think providing more education, develop some organizations for those who are not biased in this largely white community to work together.
Okay, that's good. You're getting more specific. What kind of organization? Let's hear some other thoughts. Someone put something in the chat there. Be specific. Okay, Bahá'í? Am I pronouncing your name correctly? Oh, good.
Yes. Thank you. I'm an educationist, so I always dream that I could change the curriculum. Definitely put those junior youth materials as mandatory things for junior high school, and definitely put from kindergarten very solid, grade appropriate education, definitely virtue education. Maybe virtue education. And have all the teachers go through Ruhi 3 in various ways. All the teachers go through Ruhi 5, relating the power of junior youth, very specifically.
Who would you work with, Bahá'í, to make that happen in your school?
I have, well, I'm not working right now, but I have been dreaming to contact the District of Education.
Okay, good, good.
What kind of conversation is going on? And try to get into their discourse. And with lots of prayers, asking everybody in the community to pray and consulting with the LSA and learning from small steps.
Right, right.
And learn, and then pray and reflect and see what happened.
Very good.
Even 5 teachers, heart changes, it would work. I know all the parents love that, but I don't know why the education system doesn't want to. We talk about the social and economic development. I was lucky, amazingly blessed to serve at a Bahá'í-inspired institution, which was a high school for girls. And we were directed by the OSED, the Office of Social Economic Development. And we had all the guidance that we had to study. Most of the teacher, 90% of the teacher, and 99% of the students were not Baha'is. Go through those books.
Yes. Let me ask you a question.
Yes, please.
In your community right now, to do what you wanted to do, what would be your first step? What would be the very first thing?
I would go online and try to see what are some of the issues in terms of the discourse at the education level.
Wonderful. So you have a plan of action. You see how easy it is to start a plan of action? Look at that. That's a plan of action right there. Step 1. Isn't that amazing? Amazing. That's
yeah. I had talked to some of our neighbors, and there are lots of Asian Americans here, and I asked them what are their worries. They said they love when they first come to this country, and when children are young, they love the way the children are learning. But then they get so disappointed when the kids become junior high school. It changes. They cannot have any influence in their education.
Right. You have very fertile territory. You have such fertile ground right now because you're already having these conversations with parents, and you've got these connections, and you have this educational background, and you're on your way. This is very, very exciting. Thank you for sharing that with us. You know, we'll look forward to hearing more, you know, what comes out of your continued efforts in that. Thank you so much.
It's my prayer during the fast is just
yes.
and we start doing something.
Thank you. Is there anyone else that has something they're thinking of? Who could use a community garden? Can anyone here in their community use a community garden? Amir, your hand's up.
Yes, no, not about the community garden, but I've recently heard American comedian Tiffany Haddish. She's funny, but she's also she has one of the things that she has done, because she lived through the foster children system, and she was describing her experience as she had to move from one house to another very often, and they would tell her to put her belonging into a garbage bag, and then she had to take that and move to the next place. And she felt like she's living in the garbage, because you know, the association of a garbage bag and all that, and you know, it's not the most pleasant way to live your life, and move from, as a child, move from one place to another. So she and then she said that when the first time she had a suitcase, her whole perspective about life has changed, because she felt like she's a traveler, and she's just traveling from and visiting people rather than living in the garbage. So, and she formed an organization that provides suitcases for children that are in the system.
Wow.
And, yeah, and so that applies to the States. I think in British Columbia that doesn't happen. And we have, again, first the Aboriginal or indigenous people are disproportional in the foster children system. So I would like to form some non-for-profit organization, or join an existing one and put this program into place, where we get, say from Amazon or other big retailers that are having second, like they have returns on suitcases and stuff like that, that goes to recycling, and instead of that, providing those to these kids. So that's my idea.
That's a wonderful idea. Wow. Wow. That is awesome. That is awesome.
And I've been told, and I think this is correct, that first I need to talk to the Aboriginal community and make sure that they are happy to receive something like that.
Yes, 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 very much so.
And then I'm starting to find the connection to those people, and that could also bring some friendships and stuff like that. So.
Oh, absolutely, absolutely. You've got to keep us informed on that too. Yes, absolutely. And my sister Regina is right next to you on my screen, and she knows some people. So in the First Nations community. So I think you guys have been in touch with you. Yes, you have. You all know the same people.
No,
Yeah,
we haven't been in touch, but we could. Yeah.
yeah. There she is. Yeah, that's yeah. And that's a small thing. You know, it doesn't have to be this big, huge thing, right? It can be something so small. And these are the things that change the world.
Yeah.
You know, and they give us an opportunity to be out in the community, right? We're servants. You know, we're striving to be servants of humanity. So how can we serve? And you're right. Ask the question, how can I serve you? Bahá'í asks the parents, you know, how can you be served, better served in the education of your children? Amir asked the question, you know, do you need suitcases? Right? You know, asking a question is never, well, let me put it this way. I think anyway, I'm so excited about this. I think that when you ask a question, you're not vulnerable. You know why? Because you're asking a question. You're not saying, oh, gee, I need to describe this to them because this is what I want to do. And how am I going to tell them? No, you don't have to go through all that. You know, it's just like you have a heart. You want to serve humanity. You know, I care. I have an interest in your community. How can I serve you? You're bringing them a gift. There's nothing to get tangled up about or, you know, be timid about. Gosh, you can be so joyful with that, you know, because it is where our greatest joy is, I think. Okay, I missed a hand up. Who was it? I saw the name. Yes, Carolyn. Come on, Carolyn. Can we see your face too?
Prefer not to. I'm laying on my bed and my
Okay.
head is all over the place. So if
I
possible,
got you.
I just speak.
That's all right. That's fine.
Baha'i community in an area that I was attracted to 46 years ago.
Wow.
The triracialness of the area at about equal percentage, 30-30-30. So it gave an interesting political situation where people had to cross barriers in order to be involved with each other. And I'm a physician, a family doctor, and I enjoyed the program very much. And I was really excited. I'm doing a lot of medical assisted drug treatment for opioids and trying to also deal with some occasional patients with cocaine and methamphetamine and alcohol. So what I have done is the speaker made reference to the needs of people with addictions, and it kind of rang a bell because my patients think I really love them, and I do care about them a lot, but I don't think I love them as much as they think I do. So it has to be God's love that's coming through me to them, and therefore I wanted to start a book one, a new book one, but my patients are very interested when I dare to ask them about would they like to study. Some of them ask me first, would you mind if I ask you what your religion is? But most people say, I know you're a Christian and that kind of thing, you know. But what I need is I need more support. I need somebody to go on the Zoom meetings with me. So somebody that's not able to I get out so much. I mean, I'm still working and I'm 74 years old. And so I have a little limited energy. But I know I have these contacts that would love to do it. So what I was imagining as you were all talking is that maybe I could find somebody that's a Baha'i that would like to participate as well, because it's kind of hard if it's the doctor talking, you know?
Yeah, yeah.
I mean, it makes it difficult
Mhm, mhm.
to not be too much a part of it, you know? I mean, I want to be responsive, but I also, and I have been doing 12-step groups until the virus hit us. And then we stopped, and everybody's beginning to mention, I sure do miss those groups. Are you ever going to start that?
Yeah.
Of course, I think not for a little while longer, but so my email is my name, Carolyn.B as in Baker, .McCormick@gmail. And if anybody's interested in partnering with me for these Zoom meetings, I would really love it.
Mm-hmm.
I will gather together. I have limited Zoom ability, but I did get the year program.
Okay.
That's it. Thank you.
Okay, Carolyn. Carolyn, can you put your email in the chat? Oh, I see it. I see it now. Okay. All right. Yes. Okay. Jean Marie put it in there.
Jean Marie.
Yes, that Jean Marie, she's on top of everything, isn't she? And so you're in Florida, did you say, Carolyn?
North Carolina in Robeson County, which is triracial. They used to call it the dark county.
Huh.
But there used to be even another population besides the three races, what people call races.
Yeah.
And they were called Smilings. And I said, oh my, they must be Baha'is. Smilings.
Beautiful, beautiful. Well, I'm sure someone's going to take you up. We'll put that on blast as much as we can to help you with that. Absolutely, absolutely. Okay, two other people had their hands up. Let me.
A while, so I would really like that. Thank you.
Oh, thank you, thank you. Okay, Armand, you're on mute.
Yes, yes, thank you. Real simple. This has inspired me to go and seek out Black-owned farmers or farmers markets, and try to locate them. I live in southern Delaware. Lewis is the town, but it's kind of rural where I am. So I planned to seek out and find who's in the region, and hopefully I can support that market or farmer market, whatever, and share their that business or that interaction with the friends that are in my region, and just create some dialogue, create some relationship building, and then we see where things go from there.
Yeah.
But I'm always looking for some good produce. So
I think that's an excellent idea. And it's a, kind of a funny commentary, but there is a Black farmer in the Charlottesville, Virginia area who has been, he's organic and high end and very wonderful crops. And yet he would do deliveries, and sometimes he would go into majority white communities and people would call the police on him, and he's just delivering the food. And it's, and here, this is something that's happened this century. I mean, within the last, 10 years, he's been experiencing this, and he is actually college educated. I think he was in computers for a while and decided he wanted to do farming. And yet there's still this incredible prejudice. Now they go and they buy his produce, they want his produce, and yet he steps into their quote neighborhood.
Right.
He, it was not acceptable, and it was crazy. Sherilyn, if I can, I noticed one comment that I did want to address, if that's all right with you.
Absolutely. Yeah, absolutely.
I was talking about in terms of the general population in the United States, we don't think of ourselves as being protein deficient, as in less developed countries, which need more protein infused into their diet in general for a whole, nation in terms. I'm not denying the fact that there aren't people here who are food insecure and are starving and are not getting enough of any of the nutrients. Absolutely. And that's not what I meant. I meant on a national scale, protein is not a particularly deficient nutrient in most Americans' diet. It's opposed to what you see in other worlds. So adopting a meatless Monday where you're getting your protein from a non-animal source is something that can be easily promoted here in the United States, but that's not something that could be promoted in a country that has a less secure or a less nutritious diet for the general population. And I did want to clarify that. And someone did, I thought it was great. They're saying, no, you're not vitamin D deficient, you're sunlight deficient. And I think that's absolutely right. And yes, the compound of vitamin D in breast milk is actually a water-soluble form. That is correct. Its amount, though, is not as much. And I do think that's because we evolved to get some of our vitamin D from exposure to sunlight and UVB light, actually. So, it's when we get away from what our natural behavior is supposed to be, we see. And again, if we ate more of our indigenous diet, which is a lot of greens and things, we'd be getting a lot of those nutrients as well that we don't often get from our overprocessed diet. And all of us, I myself included. We try to walk the talk. I think that's really important in my profession, but we are also victims of a toxic food environment. So I just want.
Oh, you went off mute. You went on mute.
I was just saying I wanted to address those two things that I happen to see in the chat because I thought they were good points.
Yeah, thank you. Thank you. Yeah. Amir?
Yeah, I thinking about people talking, and just remember that there's another idea that I thought related to healthcare, and that is coming from something that I heard recently from Israel. So there is a young woman in Israel who started a non-for-profit organization that provide people in hospitals a hugging bear. So hugging doll that with instructions that you're supposed to hug the bear for 10 minutes, 3 times a day, and so on. And you wouldn't believe she's been doing it for the last 20 years. And they've interviewed a man who was, I think he was in an accident or something like that. Or I don't remember exactly the reasons, but for 20 years, he's an adult, like a grown-up man. He's been holding that doll for 20 years. The doll is completely, barely holding itself. And he was sewing it again and again. And he just keep hugging it because it helped him in the most difficult time. So that's kind of another idea too. And it seems like it helps many people to help, especially in these days when you cannot talk, COVID people cannot communicate with other people. So.
There, that's an excellent point. And again, I heard on NPR this morning that we're talking about farmers. Well, apparently there is a farmer who is charging $75 to come and hug their cows. That this might seem like, but the people are so hungry for that physical and connection.
Yeah.
And they are literally paying $75 a hug to go and hug these cows. And apparently these are very accommodating cows. They'll even lay down and let you rub their bellies and do all sorts of things. But, we touch, our skin is our largest organ, and touch is so important. And it's been sacrificed.
Yeah, it is. It is. That's fascinating. Thank you, Armand. Thank you for coming. I see you're signing off. Good to see you again and have you here this evening. Yes, wow. Yeah. Well, gee whiz, you can pay me $75 and come hug my cute dog, He loves it, I wish I thought of that, but you have to be masked first. And I guess because you're outdoors, I guess cows make it easier because you're in the wide open, right? Probably. Anyone else have any, ideas or thoughts or heard about things that have inspired you that have been a form of social action? And remember, it doesn't have to be grandiose. Oh, I know what I wanted to say. Everything also doesn't have to be a nonprofit either. You don't have to make a nonprofit to do some meaningful work out there. You really don't. I've worked in the non-for-profit sector, the 501c3 as it's called. That's when you've got the federal designation that you're officially a non-for-profit. And I've just recently come across some things. I haven't read them yet, so I can't really speak to it, but some very interesting critical looks at the proliferation of nonprofits and how they are often, they may start out with an intention, but because of the reliance on funding from various funding sources, this can compromise their delivery, and what they're really attempting to do or have attempted to do. And it's a huge mega business. Philanthropy is a huge mega business. And I find that hard to wrap my mind about it because you think philanthropy is giving, right? You shouldn't be making money, right? So that's a whole area of research that I'm kind of interested in. As I said, I just stumbled across these things just the other day and just thought about them. Well, we're going to start to wind down now. And there's two ways to always get people to leave, I found out. One is to say, let's talk about, I'm going to start calling on people that haven't said anything yet. Bunch of people fly off. And the other was when I, said, let's talk about some social action, and some ideas there. And a bunch of people flew off. So we're down to our, the second cut. Jean's over there cracking up. Okay, so I'm going to start calling names.
Charlene, what you could do, as a friend of mine used to do, when it got late, she'd say, "Honey, let's go on to bed. We're keeping our guests up."
Oh yes, well, I would, but I have no honey, and that's problem one. But I get you. That's cute. Yeah, that is good. But is there anyone that would like to say anything else this evening or share anything? Jean, you? Yeah, please go ahead. Yeah. Mm-hmm.
I put in the chat.
Yes.
About Tuesdays at 7:30 Eastern, the Multicultural Health Institute in Sarasota has a weekly Zoom, and it's somewhat strategizing what to do with the COVID situation. Mm-hmm. And actually a partnership was formed. I mean, this organization it was established in 1995. It's a nonprofit. Teresa has been a big part of, I think, serving on the board. She might say something more. But what's been amazing is all these different organizations coming together and checking in each week to see what the update is on how things are happening in our local community. And it's so cool because it's our cluster. It's a 2-county area that's being covered, and it just overlays perfectly with our cluster.
Wow.
And what they do food distribution, giving out masks and information about COVID, and information about the vaccines, what I guess I would say what the mainstream belief is or understanding of how things are, but trying to dispel a lot of the misunderstanding and the confusion, but also be out there face to face, mask to mask, working with people, addressing their direct needs, taking blood pressures, checking glucose levels, getting them linked up to healthcare, because a lot of people don't have insurance or enough insurance. And so they essentially end up waiting until things get really bad, and then they have to show up in the emergency room. And now with COVID, a lot of people aren't able to go there because they'll get turned away. But why let things escalate when we can have people embedded in the community who are already looking out after their neighbors? And the MHI has worked with what they call safekeepers, gatekeepers, training the layperson how to look out and be engaged with in their neighborhoods, on their block, showing up at farmers markets, at the park when there's some event, these food dishes. So I would say, so I'm inviting everyone to come on, hear what's going on, get a feel for what's going on, and then it'll give you some great ideas and where to look in your own local community.
Wonderful.
Because really, I was really inspired by book 8, unit 1, section 26, maybe, or 13, I forget which, but it talked about in Burma, where the Baha'is had built a matricle Ascar, had set up a school and like a dispensary, a hospital to take care of people, and also had engaged in agriculture. And because of the agriculture, they then had funds to go and spread the faith even further. That's all Abdu'l-Baha did. I mean, he got knighted for starting with agriculture and feeding people during World War I. So, you know, we think that we can't do much, but he was just one person. And it doesn't, and there's so many people in our communities who are already doing things. We don't need to bring a whole cohort of Baha'is. We can be that 1%, that 1 in 10 among them, to help infuse with some of the spiritual guidance we have. But then we can also learn how to work and get active in our own communities. Okay, I'll stop. Oh, yeah, so it's all in the chat, so I hope you can share that. It's a recurring meeting with the Zoom link. So.
Well, I think Teresa's going to speak up. She's off. She's got her camera back on.
I'm grading papers at the same time and listening. I just wanted to share that Dr. Lisa Merritt has been at this initiative for over a decade.
Wow.
And has cried and prayed and asked for Baha'u'llah's help. And it is starting to emerge. She is truly in the service of humanity. And I have been able to hear her give a presentation at the last board meeting. And I'd like to share that she is starting to get national recognition.
Wow.
So it's so many levels that we addressed in this forum. And I hope that you get to log on and see what it's all about. That's what I wanted to say. But I'm going to disappear and go back to grading and listening. So.
Okay, don't disappear just yet. And then I know Malinda wants to make a comment as well. Dr. Merritt is a Baha'i. Well, we would love to have her come on and share this whole program with us. This is a phenomenal effort at social action. Could you help liaison that with me so we could
show up Tuesday and ask her to stay on as we pull up.
Okay, I'll be
absolutely.
I'll be there. That's phenomenal. Okay, thank you so much. And this will go out. I'm going to promote that as well as Carolyn's look for accompaniment and my follow-up email. I'm going to, really bring both of these things, highlight both of these things. Malinda?
Just mentioning that I think that's fantastic because it is that peer-to-peer connection that's so important. And several communities, I know it's been done in New York, and I know the University of Maryland is doing it in Prince George's County because that's where the campus College Park campus is located, is, training barbers to monitor health issues like take blood pressure and do things like that. I mean, going to the, those individuals in your community who know what's going on, the stakeholders, the informants, but the people that are trusted, and that's the key. They look like they know their community, they look like their community, they live there, they are trusted. And a lot of the skills and things that we do to keep ourselves healthy are not complicated. They're very simple. And just, being able to help someone monitor their blood pressure can save a life and make such a difference, or helping someone, make sure their blood sugars are under control. And again, several comments about how high blood pressure, heart attacks, they do present differently with different people. And again, and in his book, Tweedy's book, he talks about people coming in with very high blood pressure, really realizing any symptoms. It's that silent disease. And we talk about that as being that silent killer. But again, these kinds of things with people that they trust can make such a difference in somebody's health and life. And again, helping to eliminate this disparity. So I think this, community strategic meeting for multicultural health is just fantastic. And
yeah, it's phenomenal. Thank you. Okay, friends, we're gonna wrap it up. Anyone want to take us out with a prayer? Cliff, I see you're here, Cliff, and I know this is last minute and I'm springing this on you, but Cliff, it says Cliff and Becky on here, but Cliff has composed an original song about pupil of the eye. And I'm going to invite him to do this. Yeah, Cliff, I'm coming for you.
Okay.
And I'm going to invite you formally. Okay, so you're up front in the program, okay? But since you're here, would you be willing, are you able to share that with us right now to end our session tonight?
I'll have to move to the other room where my guitar is. But I think I could do that.
Okay, yeah, we would love it. We would love it. And you got to come off camera. Go on camera.
Just take me a minute.
No problem. No problem. I'll just talk about you while you're gone. Cliff is a white Baha'i who's just completed the From Copper to Gold course about unlearning racism and white fragility and, finding out what all that unconscious, bias and prejudices and, how to recognize those kind of stuff. Give us a picture. We need to see you, Cliff.
Let's see if I can figure out how to do that.
Okay.
Hold on.
Yeah, it'd be great if we could see you. It's beautiful. It's just wonderful. So he created this. This is his, oh, cool. There you go. Put him on speaker view, you guys. Go to speaker view if you're not already.
Great.
See him. There we go. All right. Help us out.
Let's see if I'm tuned up.
Okay.
Let's see. Thou art like unto the people of the eye. Thou art like unto the people of the eye, which is dark in color, yet it is the fount of light, which is dark in color, yet it is the fount of light, and the revealer of the contingent world, and the revealer of the contingent world. Thou art like unto the pupil of the eye. Thou art like unto the pupil of the eye, which is dark injured world. The pupil of the eye is a fountain light. The pupil of the eye is a fountain light. The pupil of the eye is a fountain light. The pupil of the eye is a fountain light.
Awesome.
Thank you.
Awesome, awesome. I just love that. I just love that. The beat, the rhythm, just yes, yes, yes. That was great. That was great. Thank you so much, Cliff.
Thank you for inviting me. This is a great program tonight.
Thank you. We're always glad when you're here. And so, yes, you will be getting that formal invitation.
Okay.
We want to share that more broadly with everyone. I think of it as your gift, you know, that you've shared with us in the group. And it was just beautiful. You know, he's a real quiet guy, usually doesn't say much. And then he just busts out, you know, with the song about the pupil of the eye, you know, wow, okay.
I originally wrote that with Becky and I teach Sunday school on Zoom now. We taught Sunday school, Baha'i school.
Uh-huh.
And we were doing a program, and I put that together I played it first there with the kids.
Okay.
We did a program about the pupil of the eye with the kids.
Oh, really? That would be nice to see.
Mm-hmm.
Okay, I'll have to keep that in mind.
Well, if we ever do it again, I'll let you know.
Okay, sounds good, sounds good. Yeah, that would be awesome. All right, friends. Hi, Julia. Good to see you off camera over there. All right. Thank you all so much, Winnie. It's great to see you again and have you in the room as always. And Patricia and Bill. Hey, Bill. I know you're proud of Malinda. It was an awesome presentation. Thank you so much. And as you can see from listening to Malinda, she's only short of being a doctor by the paper that the degree is written on. I mean, she knows so much about the body and health, and, you know, she's just, yeah, a total wealth of information. So
she did a fantastic job with that. I'm glad everybody enjoyed it. And keep in mind, our local University of Maryland Eastern Shore has an amazing agricultural program. We have a tremendous number of young African-American folk that are serious about getting back to the dirt. And we really need to support these kids. They are doing a fantastic job.
Mm-hmm. Awesome. Thank you, Bill. Good to hear you.
As well as our dietetics program, pharmacy, PA, physical therapy, and an excellent criminal justice program too.
Yeah, and
I also want to shout out to Nason and the students for their support. I mean, we couldn't have done this without their technical assistance, and I really appreciate it. Thank you so much.
Yes, yes. Thank you for saying that, Malinda. I usually, you know, thank them up front, and I knew I was off tonight. You know, it's that early after fast kind of, you know, wobbliness. You know, I knew something wasn't right. A couple of things weren't right with me, but and that was one of them. I didn't shout out to those guys, as always, because yeah, definitely, we're just so fortunate to have the folks we have. I mean, you know, just all of it so awesome. Gosh, now I don't want to go to sleep. I'm all happy and up, and you know, it's what, 11 o'clock, yeah, 10:30. Yeah, we can go a couple more hours, but no, we won't do that. We're going to go to bed early tonight because some people have to get up early for fasting tomorrow. So thank you all so much, friends. It was wonderful to see you all. Oh, we'll see you in 2 more weeks on the 27th with Celeste Dixon talking about justice and eliminating the other. So look forward to that. And as soon as this recording is ready, it'll go out along with all the information contained therein and in the chat today, the resources and references. So thank you so much, friends. Thanks for joining us, Teresa.
You're welcome.
Put you on the list. Jean Marie. Thank you. Thank you both. Carolyn, Bill, Sandy.
Nice
Good
to see you,
night.
Teresa.
Cliff, good night.
After all those years.
What? What?
I was saying it's nice to see Teresa after all
Oh,
these
Eugene, I kept looking at you. It's like,
You guys know each other.
Yeah, from way back in Chicago days.
Oh, okay.
Aloha, everyone. Bye. Good night.
Good night. Good night.
Thank you,
Thanks again.
Melinda.
night. Thank you.
Thank you, Malinda. It was awesome, awesome. Just awesome sauce. Cat socks.
You're very kind.
Cat
Good
socks.
night, everyone. Thank you again.
Good night. Thank you.
Aloha.